One day at a time, sweet Jesus, that's all I'm asking from you. Just give me the strength to do every day what I have to do. Yesterday's gone, sweet Jesus, and tomorrow may never be mine. Lord, for myself, teach me to take one day at a time. Do you remember when you walked among men? Jesus, you know, if you're looking below, it's worse now than then. Cheating and stealing.
Greetings from the Inside Studios. You are on the Virtuous Women's program. Today, our topic is birth control or contraceptives. And to help us, we have our very own. Does Glorious Worship ring a bell? Yeah, we have our own Mrs. Judith Equia Asante. Building a family is a shared responsibility between a husband and a wife. It is to ensure that you know the number of children you want to have and when to have them. So join us. We want to know what our possibilities are when it comes to birth control and what options we have. Lady Ness, you are welcome to the Inside Studios.
Thank you so much.
Thank you too. We'll go straight to the reason why we are here. We are here to talk about birth control, the various methods that we have. But first, as Christians, the Bible says that we should go into the world and multiply. If we are on contraceptives or we are on birth control, do you think we are going contrary to the Bible?
So first and foremost, I just want to thank you for this great opportunity, for you, your husband, and the whole team behind the Inside Studios. I don't take it for granted to be here. Thank you so much for your invitation. So for your first question, I believe using contraceptives is not a sin or it's not contrary to the word of God. Because yes, we know children are blessings from God, but God has also given us knowledge and wisdom to plan our lives, plan our marriage, our family, and especially our Christian life. So if children become an obstacle or become difficult for us to live a life of purpose or live a life of meaning as Christians, I think this is not a sin.
Okay, so you know, as a Christian, being on birth control or contraceptives is not a sin. Okay, if we want to explain what contraceptives are or the birth control methods, how do we explain them?
Okay, so birth control simply means planning your life or planning how many children you as a woman and your husband want to have. And family planning, as I said earlier, is how to plan your family. Yes.
Okay, so if we should decide on going on a contraceptive or to control our giving birth to children, what should we consider? What are some of the things that we should put into consideration when choosing a birth control method or a contraceptive?
Okay, thank you very much. So before a woman starts on any contraceptive, I will advise for her to go to the doctor or go to your GP or your family doctor, because your family doctor knows your medical history, knows any medical issues you have, because some of the contraceptives can be a risk on your own health as well. So the doctor should know all of these before he or she gives you a way or a method to use. And one thing I would advise all of us as women is that before we start any contraceptive, please don't go by hearsay, or my friend or my sister is using this contraceptive, so I want to try this one, because it's about your health, and every person or every person's system, every person's system is different from each other. So the way your friend reacts to that contraceptive might not be the same you will react. So please, especially we Africans, we sometimes don't want to go to our doctors for these things, or we base ourselves on African knowledge and all of that.
So actually you are saying that it is bad for me to say, okay, my friend is on this method and it is okay, she doesn't have any side effects. I shouldn't base my, I shouldn't take it that I want to go on the same pill.
Yeah,
it's not advisable.
It's not.
Okay. So because our systems are different from. Okay. So then, what are the different types of birth control methods available for us to choose?
All right. So we have the natural method. We have the ones that you don't take any pills, so that's why we call it natural, in the sense that you, the woman, you be very careful to know your period, your ovulation time, and all of that. So you will try your best not to have sexual intercourse with your husband when you are in your ovulation time. And then we have barrier control. So they are basically some contraceptives that, as the name is called, they are like a barrier. And then we have hormonal ones that releases hormones in the body. We have the non-hormonal ones, and we have the permanent ones, which we will talk about later. And yes, so those.
Someone may ask, so these types, are they really effective? Are they 100% effective?
Okay, so everything, even if it's right, and if you don't use it well, it can fail. So I would say these contraceptives, they are effective, but if you use it well, and things happen.
Accidents happen.
Accidents happen.
I'm asking this because I have been with a nurse, a health practitioner, who told me I was on this type and then I conceived. So I asked, so it means it's not 100% effective.
Yeah.
Okay.
They are not 100%. Any of them is not 100%. But of course, we have the ones that are more effective or more, let's say, more protective. So it depends on which one you use. Some people may use the less effective one, but it works good for them.
But are they effective or less effective because of the price?
No, it's not because of the price. It's because of how you use it. So it just depends on how you use it. And if you use it well, if you know, like if you have knowledge about what you are using. Many of us, maybe if you're in a country and the doctor just advise this to you, but then you don't even have the knowledge. The only thing you know is that the thing is there, so I won't get pregnant. But you don't read or you don't have information. It can be something.
So can you elaborate on the various types that we have?
All right. So for us to have a good knowledge about this, I've prepared some images that our audience will also see as well. So I will start with the, of course I've spoken about the natural one. So the natural one is basically you, the woman, knowing your period, knowing the time you are ovulating. So the thing is for you to abstain from sexual intercourse with your husband. The other one is the withdrawal or the pull out. That is when your husband is having sexual intercourse with you, and when he feels that he's about to ejaculate or he's about to release, he will be able to take the penis out from you, and then that will not cause any pregnancy. Then we have the barrier control ones. So maybe most of us think it's only the men who have condoms, but we have male condoms and female condoms. We have male condoms and female condoms. The male condoms are the ones males normally use. It doesn't cost much, and if it's used well, it can prevent pregnancy, let's say for 70 or 80% of the time. But of course, if you don't buy the right one, if you buy a loosed one, or you buy the one that has lubricant but it's oil, the ones that are oily with jelly, it's very easy for it to come off your penis. So it's the best one to use is the one that is lubricated with water. That one is the best. So as you can see, this is the male condom, yes, and then we will also see the different one, the male and the female condom. The female condom is a bit, let's say, a bit bigger, and it's a bit difficult to put on. That one you normally put it on some minutes before you have sexual intercourse. Apart from that, we have the spermicide. So spermicide is like a cream or a jelly, or sometimes it comes in as a form of a tablet that you put into the vagina 30 minutes before you have sexual intercourse. This spermicide, they basically kill the sperm, or they make it uncomfortable for the sperm to reach an egg. So normally this spermicide, we can use it with condoms as well. So using the two can be more effective. Yes, can be more effective. The female condoms, I just want to say that we have to use it, or the woman has to put it on a couple of hours before having sexual intercourse, and it's not to be used with the male. So if you're using a female condom, just use that one. If you're using the male, you just use the male condom, because both of them will not work together very well. Yes. And so as for barrier control, we have other ones like diaphragms. We have other ones like diaphragms or cervical caps. Yes. We have other ones like cervical caps, or anything that will go and prevent the sperm to reach the uterus.
Okay.
Yes, to reach the uterus. So these are the barrier ones. Then we have the hormonal ones. The hormonal ones are the contraceptive that releases hormones. The hormones they release are called estrogen or progestin. So estrogen and progestin are hormones that are similar to the normal female hormones. These hormones, they stop the release of the egg. So if the egg doesn't release, the sperm will not have any egg to meet. So this is what the hormonal ones does. And we have it as pills. We have them as patches. We have them as vaginal rings, we have them as injections as well, and we have them as implants. So I will go by one after the other to explain better. So we will start from the pills. The pills, we all know about the pills. So the pills, that one is pills that you have to take every day. So it's a bit difficult sometimes for the woman to be attentive to take it every day.
Okay, let me chip in this. If you perchance miss taking a pill, what should one do?
So if you miss taking a pill, it can be a risk for you to get infected.
Are there emergency methods that you can use to avoid damage that may have created?
Yes,
missing the pill.
Yeah, sometimes based on the type of pill you have, the instruction can be that if you've missed one day, you can take 2 the following day. All right, but then if you know you've had sexual intercourse in between, then it's another risk. Yes.
Okay.
Yeah.
Okay.
So I will carry on. Apart from the pills, we have I wanted to say something else. So these pills can give side effects. All of these contraceptives can give side effects. So pills can give side effects as breast tenderness. You can have irregular bleeding. Yes, or you can have pains as well. But sometimes some of the pills they stop from you having abdominal pains when you're having your period, because I know people who have never had sexual intercourse, but because of the strong pains they have during their period, the doctors advise them to take these pills as contraceptive to stop this period pains. Yes. Apart from that, we have the patches. So the patches, you just put it on your skin, and they release the same hormones. They release the same hormones. But one thing of the patches, you don't have to remember yourself to take it every day. So you can take it once a week. The patches, you put it on once a week for 3 weeks, and then 1 week you go without the patch. So yeah, that one is also to be taken into consideration. Some side effects of the patches can be skin irritation, or plus all the other side effects I've spoken about. Then we have the injectable. So the injectable are injections, as the word says, injections of the same hormones I spoke about, estrogen and progesterone. They can prevent pregnancy, and they are injections that you take every 3 months. So in a year you will have 4 injections. All right, and I will also advise that sometimes, yes, you take these injections, but sometimes it takes some time for them to have effect on your system. So whilst maybe you just started, ask your doctor for how long would this maybe take 1 month or 2 months for it to take effect. So during that time, what do you have to do? Can I use any other contraceptives? Then maybe yes, you can use maybe the barrier ones, or any other ones that will be best for you. Another hormonal one is the implants. So the implant one, it said that is the most effective as hormonal ones. It's a small, let's say a small instrument that is put under your skin. Normally, you can see from the picture very soon, normally it's put under your arm, so under the skin of your arm. So you will not see it, but when you touch it, you can feel it. And that implant can stay there for 3 to 5 years, depending on which type. It releases the same hormones. It releases the same hormones. This one also can cause some irregular bleeding, but it is said that it is the most effective. Yes. Then I don't know if you have it.
Yeah, talking about the changes in one's period, it can be either heavy or maybe it can even skip. When you realize you are skipping your periods or you have a heavy flow than you were told, or maybe you don't even see it, you see you have like a very low, what do you do?
Okay, when you see, because all of these contraceptives have side effects, so it is normal to expect something different, because it's something that your system, your normal physiology is going through some changes, so you will see some differences. But then when you see that it's increasing or it's yes, it's not normal, it's best for you to seek an advice of your doctor or your nurse or your gynecologist for you to tell them what symptoms you're having, and then they will know what's best to do.
Okay.
Yes. So I will carry on with the contraceptive, the types. So now we have the IUDs. These IUDs are intrauterine devices. IUD stands for intrauterine devices, and then of course it depends on where you live. As like here in Italy, this one is called spirale. Yes. So these ones, they protect for a longer time, and even these IUDs, we have the hormonal ones and the non-hormonal ones. The non-hormonal IUD is made of copper. The copper is something that naturally kills the sperm. So as we can see in the image, that is an IUD. That is an IUD, and then we will see it when it's put in the uterus of the woman. So this IUD, as we said, the one that is made of copper naturally kills the sperm. That one can stay there for 10 years. Okay. That one can stay there for 10 years. And then we have the IUD that releases hormones. That one can stay there from 3 to 5 years. Yes, from 3 to 5 years. This one, it makes it hard for the sperm to fertilize an egg in the uterus. All right, so the sperm will get there, but the atmosphere is not conducive for the sperm to meet an egg and then fertilize and then subsequently have pregnancy. They are long-lasting, but they can slip out, or they can shift their positions, and it can give side effects as a lot of bleeding, pains, but then it's also one of the contraceptives that you don't have to think too much. But then of course I believe when you're having that, it's also best for you to maybe use a condom or use something else.
I was about to ask if it is okay for a woman who is on IUD to still use a condom or any other contraceptive.
Yes, I would advise maybe in the early stages when your system is still
when you are not sure it
adapting.
is effective.
Yes, it's still adapting to
Yes.
your system.
Okay.
Then yes, you can use something else like a condom. But then it's also very important for you to tell your doctor what you are using, because maybe the one that has hormones is releasing hormones, and then you go and take pills that are releasing other hormones. It's gonna give a confusion to your whole body.
Okay. Talking about confusion to your own body, some women tend to complain that taking a pill or being on contraceptive makes them moody, or it changes their sex drive. How true is that?
Okay, all right. I believe we women normally we have our own, I won't say issues.
Our own issues.
We have our own natural way God has created us. We can be moody, we can be lively, we can be we can be many things anyway. So I think yes, because we have hormones or extra hormones coming into our body, things might change. So I believe it's very important for the husband to understand, we the women, understand the wives.
Please, can you repeat that again?
It's important for the husband to understand. It's important for the husband, please husbands, understand us. We women, we are specially made from God. And then when you asked us to take contraceptives, there are so many things going on into our system. So if one day we are not really in the mood of servicing you, please just try and understand that.
Wow, please, you can move on with your...
All right, yes, thank you. So I think we are almost done. After the IUDs, we have the irreversible methods. So I'll talk about this irreversible method. It's not only for the woman. The irreversible method is not only for the women. So we women, we go through a whole lot. From when we are teenagers, we go through things and all of that. We go through pregnancy, we go through so many things. So if there is something that the man or the husband can do to support us, it should be the best.
Nice.
Yes. So we are talking about these irreversible ones. That is called tubal ligation or sterilization for the woman. Tubal ligation or sterilization of the woman. We will see very soon from the image. So the tubal ligation, as I said earlier, is permanent. You can't go back. So please, when you and your husband come to the agreement that you want an irreversible method because you've chosen that you don't want to have kids anymore, then you go and you choose this method. But it's irreversible. You can't go back. Yes, we know God is a miracle working God, but this is irreversible.
Lady Nurse, please, you have talked about lots of methods, and it's as if most of them is for the women, and is for the women, and is for the women. Since women go through a lot, through pregnancy, childbirth and everything, is there anything the men can also do as when it comes to contraceptives or birth control, aside using condoms or withdrawal?
Yes. So as I was saying, we have the vasectomy and we have the tubal ligation. I want to start from the woman because I have a lot to say on the vasectomy. So the tubal ligation is when the tubes of the woman, the fallopian tubes, are being tied. But depending on where you live, some countries, they don't tie it anymore. Some of them cut it. So depending on where you live, it depends on the procedure you go through. This procedure is undergone with general anesthesia, so it's like a surgery. You go under surgery and your fallopian tubes are being tied. These fallopian tubes, when they are being tied, it basically means that the eggs can't leave from the ovaries. So you have the two ovaries, but if they are tied, the egg can't come out and then later go to the uterus. Yes, so we can see from the image, this is the tubal ligation. All right, okay. And then we'll go to the men. That one is called vasectomy. Vasectomy. The vasectomy is not reversible as well. It's permanent. It's permanent, and then it is even cheaper than the tubal ligation. The problem is Many men are afraid of this vasectomy because they think when they are having sexual intercourse with their wives, they're not gonna have orgasm and all of that. They're not going to enjoy it, and they think their penis will not erect or anything like that. But the thing is, it's an easy procedure. The only thing is that, as you can see from the image, the veins, or let's say in simple English, the nerve where the sperm comes out from is being cut. You just see that it's being cut. This vasectomy doesn't affect your ejaculation or your orgasm at all. So you can do this freely, and you know your woman is not getting pregnant. Alright? So please, men, take this into consideration. If we are planning our family together, if this is about partnership, if this is about understanding the woman or understanding each other, this is one of the methods that can be used from the men, because many of the contraceptives can be also a risk for the woman's health. Maybe the woman has high blood pressure, diabetes, or any other thing.
Which means that a woman needs to consider her health issues,
yes,
health history before considering
yes, of
health.
course. Yes, of course. Some of the pills can even be a problem to their own health issues they're having already. So you the man, let's say, or you coming, you the husband, trying to always push the woman can sometimes bring, let's say, a risk to the own health of the woman. So yes.
Okay. Men, over to you. You can do this to help your wife at home. And I believe that it will also help the health or the health state of the family. Lady Nurse, another question I want to ask is, what is the most popular method used by women?
The most popular method used by women is the implants.
Okay.
The implants, which is a small device that is put under your skin, because it's not something that you have to think about too much, and because the period is around 2 to 3 years, it's like whenever you and your husband come into agreement that, okay, now we want to have our next child, you can easily take it off. And one thing I want to advise is, whenever you are using contraceptives and you are thinking of having a child, sometimes because your system has gone through a lot of changes, it's not automatically that as soon as you take your contraceptive out, or as soon as you stop it, or as soon as you take your implants out, you're going to get pregnant. So I would urge all of us to have patience. Sometimes some systems need more time to come back to their normal state. They need more time to adapt to what God has created. So sometimes some people, you just take it off, they just get pregnant in 1 month or the following week. Some people, they need 6 months, 8 months, and then of course we know God's time is the best. So just need to have this.
Okay. I think we have some comments scrolling on YouTube. We have King Philippa, who says we have Lady Asante in the building. That goes to our Lady Nurse. And then we have Manon also giving us, I think, a thumbs up. We have Mrs. Ansa. I think she wants to keep quiet, or I don't know what she wants to write. Then we have Mrs. Ruth Asamwanya, who's saying yes. So I believe she's saying yes to what the men need to do to help the women. Yes, wow, thank you very much. Thank you very much. Lady Nurse, my next question is that some women tend to have difficulty in conceiving again after being on some contraceptives or some methods. Why is it that way? I'm asking this particularly because I have a friend who has been on, she was on IUD after having her first girl. And then after she took it out to have a second, for her waiting to have another.
Yeah.
And up till now, for over 4 years, it's not happening. What could possibly be the problem? Is it because of the IUD or?
As I said earlier on, this contraceptives, they can change your system. They can make things slow down a bit, because I said there are hormones that are adding up to your system.
Okay.
So it's going to be a bit difficult or challenging for you to start conceiving again. But then it's also important for us not to think too, or let's say not to base all our attention on the contraceptive. I will also urge the person or whoever is going through this, that with prayers and having faith in God, that God will surely bless them with the child, if that's the will, if that is the will of God, of course.
Okay, thank you very much. I don't know if there are any questions that we need to answer. There are no questions yet, and so we would like to draw the curtains and our discussion, and we hope that we'll come your way another time. If you have any particular topic about health that you would like us to talk about, please, you can comment or you can send us a message on our Facebook account, the Senior Osikini George's account, and then we'll see if we can be of a help to you. Lady Nurse, please, can we have your final words?
Okay. So in conclusion, I would like us to know that it's very important as human beings to plan our lives individually, as a married couple. So it's very important for us to plan our marriage, our family, and our lives. So if having children is going to be a stumbling block on your own purpose of your life, or your own growth, your own Christian growth, I believe it's very important for you to take that into consideration and to plan it. Plan your life. Know when you want to have what. Of course, God blesses, and when God blesses, you don't have any say. But it's also important for us to know that having a purpose life or having a planned life is also the best for us. If we have enough kids that we can take care of, and then we have a good life, that will be the best, rather than having too many children and we can't even take care of them, and then your life becomes a burden. So please, yes, we are Christians, but then it's also important for us to plan our lives.
Thank you very much, Lady Mrs. Judith Epia Asante. Actually, she is a nurse from the L&D Hospital in Luton, UK. Thank you very much for coming.
Thank you so much.
You are being of a blessing unto us. Thank you, our viewers. We know that this has been insightful and informative. This program, and we believe that has been a blessing unto you. And then as couples, we know you take the necessary precautions to make your home a better place for everyone. You are a virtuous woman. You are a virtuous woman. So, as a virtuous woman, always remember that you are the manager of your home. So, you need to do everything to make your home a better one. Thank you, and God bless you. Bye for now.